Hi, my name is Madeline Lepick, and I will be presenting on how cleft lip and palate are related to speech sound disorders. First, what is cleft lip? Cleft lip is a birth defect that occurs when a baby's upper lip or mouth doesn't form properly during pregnancy. The joining of tissues that forms the facial features isn't completed before birth. This results in an opening in the upper lip, which can either be a small slit or an opening that extends to the nose. Children that have cleft lip can also have cleft palate. What is cleft palate? Cleft palate is a birth defect that happens when the tissue that makes up the roof of the mouth isn't formed completely during pregnancy. This can happen to both the front and back parts of the palate, or just one part. 1 in 1,600 babies in the United States are born with both cleft and lip palate. In the image on the left, you can see the opening in the child's palate, showing just cleft palate, but in the image on the right, you can see an opening in the palate in the upper lip and nose, showing that the child has cleft lip and cleft palate. Now, how is cleft lip and palate related to speech sound disorders? Cleft palate speech is used to describe speech sound errors that are a common result of cleft palate. The resulting sound errors from this birth defect can be classified as an articulation disorder, which consists of difficulties in coordinating the articulators in production of a limited set of phonemes. A specific error seen is called a distortion speech error. This is a characteristic of disordered speech involving production of an allophone of intended phoneme. An example of this could be sit sounding like fit. Some other articulatory errors can be glottal stops, which are formed by a pop of air when a child forces their vocal folds together. An example is ball sounding like all due to the omission of a consonant. Next is a nasal fricative, which are formed by directing a stream of air through the nasal cavity instead of the oral cavity. Pharyngeal fricatives are formed by pressing the base of the tongue against the back of the throat and releasing a stream of air for speech. And mid-dorsum palatal stops, which are formed when the mid-dorsum contacts the middle of the roof of the mouth and is used as a substitute for T, D, K, and G. Along with articulation disorders, resonance disorders can also result from cleft lip and palate. Resonance disorders describe an unusual amount of nasal sound energy during a child's vocalizations. This can lead to hypernasality, which means too much nasal energy and makes a child sound nasally. Hypernasality could also mean velopharyngeal dysfunction, meaning the palate isn't working properly and may need more extensive treatment. And then hyponasality, which means too little nasal energy, causing the child to sound like they have a cold. And then you could also have a mix of both hypernasality and hyponasality. Although the cause of cleft lip and palate is still unknown, research has found some possible risk factors, which include genetics, smoking during pregnancy, maternal diabetes, using drugs and alcohol during pregnancy, some medications, and poor prenatal health. Some treatment options that are available are speech therapy and speech surgery. Speech therapy is used to establish correct articulation and replace speech sound errors with new motor speech patterns. In surgery procedures, use could be pharyngeal flap or sphincter pharyngoplasty. These procedures are recommended within the first 12 to 18 months for a child and are effective for more severe cases. Speech therapy for cleft lip and palate. The goal is to establish understandable and intelligible speech by school age and help children learn to use their tongue and lips properly. Some special equipment like video fluoroscopy and nasometers can be used to assist therapists in the diagnosis and treatments. I have attached an example of a video fluoroscopy of a patient with VPI who is swallowing pre-surgery. Speech therapy can be effective in the treatment of mild hypernasality, but more severe cases may need surgery. Here are some pictures of special equipment used in speech therapy for cleft lip and palate. Here is a snapshot of the video fluoroscopy that shows a lateral view of a velopharyngeal closure during speech. And under that is an image that shows the parts of a nasometer in cleft palate assessment. Some follow-up questions that I have after this presentation are: 1. How would you transcribe a distortion speech error with the word sit? 2. Why is cleft palate speech considered an articulation disorder and not a phonological disorder? And 3. Is improper velopharyngeal closure related to hyponasality or hypernasality? And then here are a list of all the references that I used to create my presentation, and thank you so much for listening.